Welcome to the COVID-19 Researcher Spotlight Series. I'm your host, Lydia Morrison, and today we're sharing an interview with three scientists from the San Francisco Bay Area who work to establish COVID-19 testing for Californians as a collaborative effort between UCSF and the Zuckerberg Biohub. Eric Chow, Amy Kistler, and Emily Crawford have helped provide reliable COVID-19 testing, as well as genomic sequencing of SARS-CoV-2 to better understand and diagnose the spread of the coronavirus in California.
Hi, Eric, Amy, and Emily. Thanks so much for joining me today.
Thanks for having us.
Yeah, thanks for having us.
So I was wondering if we could sort of circle up with each of you and have each of you tell us a little bit about your COVID-related research.
Yeah, I can go ahead and start. This is Emily. My background is as a protein biochemist, but in the past 5 years or so, I've been focused on development of novel diagnostic methods for infectious diseases. So it was a relatively easy transition for me to start focusing entirely on COVID-19 when the pandemic began. And I am now running a clinical diagnostic testing facility hosted by UCSF and the Zuckerberg Biohub, where we take samples from public health departments around the state of California, and we return clinically reportable PCR results showing presence or absence of SARS-CoV-2. And Eric has been helping out setting up the lab as well over the last few months.
This is Eric. My background is in genomics around next generation sequencing as well as automation. And a lot of the focus of my previous research before COVID is on improving ways of using technology to do genomic research, such as new ways of doing NGS library prep, different ways of using automation to enable higher throughput sample processing. And so some of these skills definitely applied well to the current situation, where we need to do a lot of nucleic acid-based tests to detect SARS-CoV-2. And over the past couple of months, I've been really involved in the UCSF Zuckerberg Biohub efforts to get a testing lab booted up and to scale up operations.
My name is Amy Kistler, and I've been focusing on the sequencing efforts, the genome sequencing efforts of the SARS-CoV-2 that are circulating in California. My background is in viral genomics and virology, and it was a very natural transition for me to shift gears with the established metagenomic sequencing efforts that we've developed here at the Biohub, a number of them that Emily has been significantly involved in developing, to pivot to begin looking at those strategies for mapping the distribution of SARS-CoV-2 to understand its transmission and circulation in California.
And Amy, just to stay on that topic, how is your work in sequencing the genome of SARS-CoV-2 going to inform our understanding of the virus and inform our understanding of how it's moving through the state of California?
So SARS-CoV-2 accumulates mutations at a rate of about 1 per every 2 weeks. So we're seeing mutations. Mutations can arise over the course of transmission events. And what this allows us to do is understand when we see cases arising, how closely related they are in space and time, as well as in genetic sequence. And that helps us with collaborative information from epidemiologists at departments of public health, where a number of the samples are coming from, to really get a much higher resolution picture of how the virus is actually moving around. Each mutation or the sequences of the virus, you could think of them as kind of like a barcode for the virus. And so we can be following the viruses based on their barcodes as they move around the state.
That's really interesting. Emily, just to follow up on specifically the research that you're doing, could you talk us through the workflow for detecting SARS-CoV-2 in patient samples that you're receiving?
Yeah, sure. So I'll start by giving a little bit of background on how our testing facility got started, if that's okay. So, I've been a research scientist for my whole career. And so have Eric and Amy and most of the people that we're working with now. But back in March, the governor of California made a few small tweaks to regulations around who can do clinical diagnostic, clinically reportable diagnostic testing in the state. And as a response to that, UCSF realized that they were sort of sitting on a great resource to help out the community, which was a large number of graduate students and postdocs, a lot of equipment, a lot of expertise in doing the thing that's most needed by the state and by the world right now, which is testing people for SARS-CoV-2. So in early to mid-March, we transitioned our research lab space into a clinical diagnostic space where we now take samples in and result out presence or absence of SARS-CoV-2. And the process, it's interesting. It's been an interesting learning experience to understand what the different challenges are with doing clinical diagnostic as opposed to doing a research test. The most notable is that the difficulties and the hard work all happens upstream of the analytical steps. So we receive from our public health department partners hundreds and thousands per day, actually, of tubes with samples in them. So these are collection tubes containing the nasopharyngeal swabs that everyone is familiar with. And we need to enter the patient information from that tube into our database, and we need to transfer the material in the tube into a 96-well plate format so that we can process it in high throughput, and then actually proceed with the PCR. So, one of the biggest challenges there is just how do you take samples in tubes and transition them into plates. And actually, Eric has been sort of spearheaded the efforts to figure out how to do that early on. We have a couple of different robotic solutions for making that transition happen. But it's something that, as a researcher, you don't necessarily think about that step as being the biggest challenge. But when you're actually trying to do this work at scale, that becomes potentially a big bottleneck. So after the samples are in plates, we do RNA extraction, just the way you would do in any kind of typical research setting. And we do that in 96-well format on a liquid handling robot. And then we transfer the sample, the RNA, into 384-well plate to do PCR reaction. And early on, we played around with a few different sets of PCR probes and made the decision to use one N gene probe and one E gene probe, which we thought performed best in our hands. And so that's how we developed our EUA assay based on those two. And then the final step that's really important to think about is the data processing. And another key aspect of setting up the lab was creating a LIMS system, a laboratory information management system, where we were able to keep track of all of the information sort of came with the tube to begin with, and then connect that to the results in the end. And the actual resulting where the positive or negative result goes out to the clinician or the public health department, that is taken care of by our clinical lab partners over at UCSF.
I just wanted to highlight how Emily's workflow is somewhat the sequencing workflow is kind of an outgrowth of Emily's workflow.
Yeah.
Early on during the outbreak, the huge priority for us here was to develop surge capacity for testing as we were seeing the pandemic unfold. And what Emily described got spun up in an amazingly rapid time, and on the order of about a week from ground zero to the first testing. And am I correct, Emily, for the CLIA hub, 8 days? And so what she described is that, happened tremendously rapidly. And in terms of the sequencing workflow, that was something that was sort of has been a secondary follow-on work in terms of the public health need and urgency. And the work that Emily and Eric did to pull all this together, actually, we were on the sequencing side, we had established metagenomic sequencing flows, et cetera, for basic research. And so there was less development there that needed to be done from the ground up, but a follow-on workflow needed to be developed. in order to be able to process the samples that people were sending directly to us, as well as samples that were coming that we had clearance to carry out sequencing analysis that were coming through the CLIA Hub testing lab. So all the work that they did and the groundwork they laid was a great model for us as we built additional tools to enable both metagenomic and amplicon sequencing of SARS-CoV-2. And even at the level of, a lot of the labs were sending us tubes, and we needed to move things from tubes to plates to automate it much in the same way that they did downstairs. And all the groundwork that Eric laid for processing clinical samples also worked with processing RNA samples that were sent to us from different labs around the state.
That's really phenomenal that you were able to implement those new systems. And I'm sure there's lots of new regulatory requirements that you needed to meet. 8 days seems like a phenomenally short amount of time to be able to accomplish that in. Eric, do you want to speak a little bit to what it took to be able to implement those robotics to allow for this magnitude of samples to be tested?
Yeah, definitely. I would say that everything that we're describing here is the work done by dozens and dozens of people at UCSF and Biohub to get this together. As you mentioned, getting a lab booted up in 8 days to do CLIA testing is no small feat. And a lot of this is really due to the really close cooperation and really tight teamwork between the groups here. I'd say especially with the UCSF clinical labs that provided a lot of guidance. As Emily and Amy both mentioned, we're all research scientists. We don't do CLIA testing as our professional lives, and so we really depended on the expertise from those groups to guide us on how to file the FDA EUAs for our laboratory developed tests. And without their help, it just wouldn't have happened. But in terms of the robotics, a lot of this is working with different vendors first to see which vendors could deliver equipment in a rapid manner. As you imagine, you've heard about supply shortages for reagents for doing COVID testing. The same thing is happening with equipment as well. So the first thing was finding automation vendors that we could find that could provide the supplies and equipment in a timely manner, and we were able to do that. And to also work closely with those automation vendors just to get the programs developed. We had ideas of how we wanted the workflows to operate, and work really closely with some of the application specialists at these automation companies to enable those workflows to happen.
Well, it's a good thing you had such strong relationships built with them already.
Yeah, definitely. I think we've all used quite a bit of automation at Biohub and over at UCSF, and so we're definitely able to leverage those existing relationships.
So I'm curious, now that you're up and running, and I know that California is experiencing a surge in cases again right now. We're recording this on July 17th, and California is sort of in the middle of a new wave, or maybe the second half of the first wave. So how many samples are you able to process in a day, and what does that look like in terms of sample turnaround time?
Yeah, I can speak to that. So I think our average number of samples per day that we process hovers around 1,000 per day. Our record, which we set just this past Sunday, actually was 1,932 samples processed in one day. And so there has been a trend upward in how many samples we're receiving, and we're doing our best to accommodate that. Again, working with just a phenomenal group of people in the lab. We're mostly staffed by volunteers, UCSF PhD students and graduate students, and actually MD students as well, who come in and give us their time, after they're done with their normal research days or classes or whatever it be. They really have been phenomenal in stepping up and coming in to help out. And donate their time. We really appreciate that so much. But we are also working on ways to improve our capacity, because we know that it's very badly needed, and we're trying to do that while also keeping an eye on our turnaround time, because we know that the value that we provide to the public health department partners is really in how rapid we are. When they send samples right now to Quest or LabCorp, Unfortunately, most of the time they have a several day turnaround time, and that can be really detrimental to trying to control an outbreak. So, we know that we have to keep our sample numbers relatively low in order to not build up a backlog. So that's kind of something that we think about regularly, and we work closely again with our UCSF partners, and we also work closely with the public health departments to communicate with them about what their needs are and how we can best meet them.
Well, that's really important. And it sounds like the collaborations and the communication that you've been able to establish are really key to a lot of the success of the turnaround time and the system that you have set up there to support the community and the state's testing efforts. I'm curious, Amy, why is this work important to you?
One piece about the work that's important to me is just being able to apply, modern 21st century approaches to this question that's really where technology can make a big contribution. So, a lot of the tools that epidemiologists in the public health sector have available to them are not really that different. Boots on the ground epidemiology is not that different from what was done during the pandemic of influenza in 1918. I mean, certainly we have some more sophisticated tools on that front, but it does boil down to kind of tracking down leads and, digging through paperwork, et cetera. And if there's a way that we can contribute to helping them solidify the data that they have, that's important to make potentially really challenging public health interventions, such as understanding if it's an outbreak in a congregate setting, like a skilled nursing facility or some kind of a workplace where there's a question about whether that workplace needs to shut down. Really being able to have sequence data that is hard data that can help you clarify the inferences you have about whether something's an outbreak from a single introduction versus potentially multiple sources feeding into cases that are occurring around the same time can be incredibly helpful for our public health. And just to be able to help them do that in a rapid way with these new technologies that may not be readily available in all the public health labs, I think has been really important to me.
Yeah, and certainly an advantage for Californians.
We have Silicon Valley is one of our neighbors, and I think people generally think about California as the center of high technology, and the idea of being able to, whether it's testing or sequencing, deploy all the technology and expertise that we have available in the state to help address the pandemic and maybe control or mitigate the outcomes associated with the pandemic. That's really important to me to be a part of that and to be driving that forward.
So I know that all of you are involved in a lot of collaborations regarding COVID-19 research. Could you tell us about some of them?
Sure. I can just talk briefly about some of the clinical research studies that we've been able to be involved in. So another value to having this testing capacity has been not only to be able to help with fulfilling public health needs, but also to support research studies that have gone on in the community. The most notable one that we participated in back in, I guess it was back in April now, or maybe May, was a study in the Mission District of San Francisco where a UCSF group was able to partner with some local community groups in the Mission District to set up a very comprehensive testing campaign over the course of a couple days where they tested about 4,500 people from one small census tract in the Mission District. And we were able to process the samples there and deliver results. And there were a number of people who tested positive, many of whom were asymptomatic. So that was valuable information on an individual level, as well as valuable to understand the extent of asymptomatic infection in our community. And what was really valuable about that study is that it was done by Diane Havlier's group at UCSF, and they put a lot of thought into designing it in a way that we would get useful information out of it. And kind of the really key take home from the results was that there was a very strong increased risk of testing positive among people who were unable to work from home. So people whose jobs required them to be out of the home and be out in the community. This is what we refer to as essential workers. Those are really were the people that were being hardest hit. And so it really highlighted for us as a city and as a community, I guess, how big the disparities are with this disease already, where we're seeing certain groups of people hit really harder than others. And I think that has helped us all to kind of refocus our efforts, both in testing as well as in public policy, to try to support the people who need it most.
I can speak to the sequencing aspects that are both linked to the work that Emily has been doing, as well as independent basic research that we're doing here on SARS-CoV-2 as the outbreak unfolds. So the mission study that Emily described was a really, really great collaboration and example of the synergy that we can have between the testing that's going on in the CLIA hub and the sequencing that we're carrying out at the Biohub for research purposes. So among the samples from the Mission District study that Emily described, we identified and cherry-picked through the automation practices that have been developed downstairs and upstairs. We were able to, through the LIMS system that was developed, rapidly identify all the positive samples from the Mission District study, cherry-pick them for sequencing upstairs, perform sequencing, and then begin to analyze how any patterns that we were seeing of the types of clusters that were identified epidemiologically in the really careful, high touch epidemiologic work that Diane Havlier's group was doing, and what, in terms of the data that was going on in households or contacts among the people that in the community that participated in the study, and the actual sequences of the viruses that we were seeing arising within the positives. And so that was a really beautiful illustration of how the testing through to sequencing can help us to really understand how the virus is moving within a community. And what was really gratifying, I think I can speak for myself and probably for Emily to say that, Diane Havlier's group was also going back and returning to the community to follow up with the families and the patients and the positives for treatment and further clinical follow-up. And so that was a great experience to be involved in that. So I guess aside from that study, there are sort of three categories of sequencing research that we're doing around the SARS-CoV-2 during the pandemic. One is also somewhat tied with Emily's work in that we are, through the connections that Emily forged with departments of public health, we extended those to invite departments of public health to provide us samples for sequencing for epidemiologic analysis. We did that in small scale, and now that's sort of turned into sort of a bigger project where we've opened the doors for free sequencing to all county public health labs, as well as the state public health lab. And that's a project we're calling internally here at the Biohub COVID Tracker. But there have been some continued discussions with the Department of Public Health of California, and they're expanding and kind of connecting an effort, a more statewide effort they're calling COVID-Net, that includes not just the Biohub, but other academic and potentially commercial labs that can facilitate sequencing of isolates across California to get a better understanding of the phylogenetic tree of SARS-CoV-2 circulating in California, as well as to help public health labs with epidemiologic tracing. So that's one big project, and that's really been spearheaded by actually data scientists at Biohub, Joshua Batson, David Dinerman, and also our biosecurity fellow, Patrick Askew.
Well, I'll certainly be interested to hear how those studies play out. I think it's really important information, not just for the community of California, but really for the United States as well as for the rest of the world right now. I just wanted to thank you all for your collaborative spirit and your ingenuity in bringing this fast, reliable testing and genomic sequencing to further the understanding of the spread to the state of California. So, Emily, Amy, and Eric, thank you so much for taking time out of your research schedules to talk to me today.
Thank you.
Thanks for having us.
This interview was recorded prior to the CLIA Hub COVID-19 testing facility being closed in October as testing capacity improved in California. Testing for the public health departments is now being conducted at UCSF, among other locations. Overall, the group completed more than 160,000 tests. Amy is continuing her work at the Zuckerberg Biohub. With the recent surge in COVID-19 cases in California, her group has received a deluge of COVID-19 positive samples for SARS-CoV-2 genome sequencing. This COVID tracker genomic epidemiology project with California County Departments of Public Health and the state DPH will continue into 2021 with an added emphasis on capacity building. Emily has returned to her research at UCSF, and she continues to support the project as an independent consultant. Eric is currently back to running the technology team at the Laboratory for Genomics Research, a functional genomics collaboration between UC San Francisco, UC Berkeley, and GlaxoSmithKline. The goal of this collaboration is to develop and deploy new CRISPR-Cas-based screening tools to better understand the genetic causes of diseases.
Thanks for listening to this episode of the COVID-19 Researcher Spotlight Series. Join us next time when I interview senior scientist Bejoita Roy, who leads a lab in the RNA Research Department here at New England Biolabs. Bejoita will walk us through the process of COVID-19 vaccine development, with a focus on mRNA vaccines and the promising candidates awaiting FDA approval. She'll also discuss with us how NEB research scientists are working to improve and streamline mRNA synthesis workflows.